This short video will demonstrate the application of C-Topical, cocaine hydrochloride, for nasal procedures. C-Topical 4% solution is a topical anesthetic with vasoconstrictive properties. C-Topical is indicated for the introduction of local anesthesia of accessible mucous membranes of the oral, laryngeal, and nasal cavities. It is not for injection or ophthalmic use. For nasal procedures, the dosage varies and depends upon the area to be anesthetized, vascularity of the tissues, individual tolerance, and the technique of anesthesia. The lowest dosage needed to provide effective anesthesia should be administered. C-Topical should be administered using cotton or rayon pledgets. Clinical studies have demonstrated that when utilizing pledgets, serum levels show only 33% of the drug is absorbed, leaving most of the dose to act locally. Direct application of cocaine solution to the nasal mucosa may result in levels 4 to 5 times greater than application with a cotton pledget. Minimizing systemic absorption is estimated to contribute to lower adverse events. Using a syringe calibrated in milliliters with a capacity of at least 4 milliliters, draw the entire contents of C-Topical. Stack 2 half-inch by 3-inch pledgets. Saturate the top of the pledgets with 1 milliliter of C-Topical. Saturate the bottom half by turning over the stack and applying another 1 milliliter of C-Topical. Repeat this with another stack of 2 pledgets in order to have 4 evenly saturated pledgets. While the number of pledgets is discretionary based on diagnostic procedure or surgery, whether it is unilateral or bilateral, and on the size and geometry of the patient's nasal passage, it is recommended that 2 pledgets be used for each treated nasal cavity. Within 3 minutes, apply the pledgets to the subject's nasal cavities as shown here. A 20-minute pledget application time period is recommended. The onset of anesthetic action begins within 10 minutes and may last up to 1 hour. C-Topical is manufactured in accordance with current GMPs to ensure identity, strength, quality, stability, and purity. For full prescribing information and to learn more about C-Topical, please visit ctopical.com. C-Topical, cocaine hydrochloride solution 4%, is indicated for the introduction of local topical anesthesia of accessible mucous membranes of the oral, laryngeal, and nasal cavities. C-Topical cocaine hydrochloride solution 4% is contraindicated in patients with a known history of hypersensitivity to the drug or to the components of the topical solution. C-Topical is not for injection or ophthalmic use. Resuscitative equipment and drugs should be immediately available when any local anesthetic is used. The most prevalent adverse reactions are mild reversible hypertension and mild reversible tachycardia. Adverse reactions may be systemic in nature, involving the central nervous system and/or the cardiovascular system, or they may be local and reactions may occur at any dosage level. Some reactions may result from vasoconstrictive properties of cocaine hydrochloride, hypersensitivity, idiosyncrasy, or diminished tolerance on the part of the patient. The lowest dosage that results in effective anesthesia should be used to avoid high plasma levels and serious adverse effects. Debilitated elderly patients, acutely ill patients, and children should be given reduced doses commensurate with their age and physical status. Small doses of cocaine slow the heart rate, but after moderate doses the rate is increased due to central sympathetic stimulation. Cocaine is pyrogenic. It augments heat production during stimulating muscular activity while decreasing heat loss through vasoconstriction. Cocaine is known to interfere with the uptake of norepinephrine by adrenergic nerve terminals, producing sensitization to catecholamines, causing vasoconstriction and mydriasis. Cocaine causes sloughing of the corneal epithelium, causing clouding, pitting, and occasionally ulceration of the cornea. The symptoms of cocaine poisoning are referable to the CNS, namely the patient becomes excited, restless, garrulous, anxious, and confused. Enhanced reflexes, headache, rapid pulse, irregular respiration, chills, rise in body temperature, mydriasis, exophthalmos, nausea, vomiting, and abdominal pain are noticed. In severe overdoses, delirium, Cheyne-Stokes respiration, convulsions, unconsciousness, and death from respiratory arrest result. The fatal dose of cocaine is approximately 1.2 grams, although severe toxic effects have been reported from doses as low as 20 milligrams. Application of cocaine hydrochloride with cotton or rayon pledgets reduces absorption to approximately 33% of the dispensed dose. For additional information, please see the C-Topical full prescribing information. You are encouraged to report negative side effects of prescription drugs to the FDA. Visit www.fda.gov/medwatch or call 1-800-FDA-1088.